We're talking about this new report out that recommends that all adults, particularly pregnant women or those who have just given birth, be screened for depression. Our guest is Christy Nice. She is a psychotherapist, speaker, and author, and she's here to talk about this new report. I've read that 1 in 7 women may suffer from some postpartum depression. Why is that the case?
You know, that is such a high number, and you're right. It's staggering to hear that women are struggling at that level. The case is because of lack of awareness and care. That's what I love about this out now. There is this new awareness where doctors will be urged to check into it even further.
And there is the question of whether this will be covered by insurance. Is that part of the equation too?
Correct, and it will be. Yes, this will now be covered as part of insurance. It's essential that doctors follow through and use that insurance to care for their patients.
What would you tell the doctors who and we discussed a little bit of this earlier, who say that they feel that they are not equipped to treat a woman, and the pediatrician says the baby is my patient, not the mother, but particularly the fact that I read that they feel that they're not equipped and may be open to some sort of lawsuit if they do something wrong?
You know, I think that's a great point. What's nice about our community is we do have other mental health professionals out there willing to support. Where it may become a crisis, my concern, is with psychiatrists. There is just a shortage of psychiatrists to be able to treat. So then the referral will be to the mental health, a psychotherapist as myself, in terms of treatment initially and to connect with the psychiatrists.
So are there steps to the treatment that they go to from you, the psychotherapist, to the psychiatrist? And I've read also that talking about it can be treatment enough.
Yeah, it really depends on the person and what their needs are. If they're in acute status in terms of not able to function day-to-day in life, both with self-care and care of their children, medication initially may be warranted. However, that's not always the best first step. Oftentimes, referral to talk therapy, dialectical behavior therapy we use, really helps them work through identifying the issues and moving through without medication. So medication is not always required for depression.
Women who have been treated for this with medication, sometimes I read that there are like 13 different medications, and you have to try one until you find one that works. Why is that the case?
That actually is rather rare. Although you've read about it, it isn't as common as many people think. Many are really able to maintain on the first or second medication at the very most in terms of their symptoms for depression. Rarely do they have to go through several medications. They've just got it honed so well now, that's not as much of an issue.
Okay. What can you say to what I call these pioneer mothers who say, I had 5 kids and we didn't even have an epidural or any of these other things, and I don't understand why my daughter is having these kinds of problems. Is this a modern day occurrence? And what would you say to one of those pioneer women who survived the planes and covered wagons and natural childbirth and all the rest, who have that attitude? That's the question I'm addressing.
Sure. You know, what's comforting is that the more and more awareness there's less of a stigma. So there are less pioneer women than what there used to be. However, my challenge would be, if that is what your attitude is, then what are you seeing at home? Are you seeing issues? It's rather a lack of education that women become pioneers about it rather than ignorance, right? So simply giving them the knowledge to make a good decision about how to care for their family equips and empowers them to do so.
So you mentioned stigma. So does the mother feel then, when they're suffering with this depression, that I'm not a good mother?
Oftentimes that is the case because they don't understand what's causing it. Having a baby in particular, as we were referring to earlier, is supposed to be a time of joy. However, the hormones are shifting, so they begin to doubt themselves and what's occurring, therefore repressing it and not dealing with it as soon as they needed to.
So what's your advice to mothers everywhere?
My advice to mothers everywhere is, if you're noticing more sadness than usual, to not hesitate to get the care that you need. Do not allow the stigmas of others to really influence your decision. You have a role. You have an accountability to your family and your children. Do not hesitate to get the care that you need.
Christy Nice, thank you so much for being here. Very enlightening.
Thank you so much for the time.
All right. I'm Chris Moore. We're going to take a break, but we shall return. Stay with us.